Hi, this is Dr. Paul Chasan at Ranch and Coast Plastic Surgery, and I was asked a couple weeks ago what were more interesting cases, unusual cases that I've done, and this one comes to mind. This is a 32-year-old, and she had buttock implants placed, and then it was infected and had to come out and then placed back in, and then the implant kind of got into a subcutaneous plane. Usually buttock implants are on an intramuscular plane, and you could feel it and you could feel the implant, and she just was unhappy. She likes to wear bathing suits. She's a sexy lady. What we did is we took out implant and then replaced a new implant back under the muscle, and you can see here, this is where the scar she has, because evidently whoever put it in, you didn't really know what they're doing, and they got infected and took it out through here. But look how her buttock looks much better. You see the implant, you can see that, and now that we put it in the intramuscular space, how much better that looks. There's only about maybe 4 or 5 surgeons in the Southern California area, that includes Beverly Hills, Orange County, San Diego, that really have any real experience with buttock augmentation using implants, which I think is a wonderful operation, and it should go well. And it's a smooth operation. It's a straightforward operation if you know what you're doing. But there's not many guys doing it or having experience doing it. And so the last guy who did this was inexperienced. He went through a midline incision, which no one who's experienced does anymore. We all do a paramedian incision. We all put it deep in the intramuscular area. And a lot of the time, we'll not only do the buttock implant, we'll do a composite with a smaller buttock implant to give the projection, and then use fat to surround it to give the volume. So if you're looking for buttock augmentation, you gotta make sure that your surgeon is very experienced at buttock augmentation and can show you at least a dozen pictures of patients that they have performed.